Abortion, a word that sparks intense debate, evokes powerful emotions, and influences laws, healthcare, and individual lives across the globe. But what do we really know about it? Today, we're diving deep into the facts, history, ethics, and realities surrounding abortion. Let's begin with the basics. Abortion is the medical process of ending a pregnancy so that it doesn't result in the birth of a baby. This can be done through medication or surgical procedures. There are two main types. 1. Medical abortion, typically done within the first 10 weeks using pills like mifepristone and misoprostol. 2. Surgical abortion, involves procedures such as vacuum aspiration or dilation and evacuation, D&E, usually performed in clinics or hospitals. Globally, around 73 million induced abortions occur each year, according to the World Health Organization. Abortion has been practiced for thousands of years. Ancient Egyptian, Greek, and Roman texts describe herbal methods and instruments used to terminate pregnancies. In the 19th and 20th centuries, laws criminalizing abortion spread across Europe and North America. These laws were often driven by a mix of medical safety concerns, religious influence, and social control over women's bodies. But the tide began to shift in the 20th century. Countries like the Soviet Union, the United Kingdom, and later the United States started to legalize abortion under certain conditions. One of the most pivotal moments came in 1973, when the U.S. Supreme Court ruled in Roe v. Wade that the Constitution protects a woman's right to choose an abortion. This landmark decision would remain controversial for decades, and was overturned in 2022. From a medical standpoint, abortion is considered a safe procedure when done legally and under proper healthcare conditions. Complications are rare. In fact, abortion is statistically safer than childbirth. In countries where abortion is heavily restricted or banned, many women turn to unsafe methods, leading to approximately 25 million unsafe abortions annually. These often result in severe injuries or death. Doctors emphasize the importance of access to accurate information, early pregnancy care, and safe procedures to protect maternal health. Abortion is one of the most ethically complex issues of our time. At its core, the debate often centers around two fundamental questions. 1. When does life begin? 2. Who gets to decide what happens to a pregnancy? Pro-life advocates argue that life begins at conception, and that abortion is the taking of a human life. Many draw from religious or philosophical beliefs about the sanctity of life. Pro-choice advocates argue that a woman has the right to control her own body, including the decision to continue or end a pregnancy. They emphasize autonomy, privacy, and the broader social and economic context of motherhood. These views aren't always binary. Many people hold nuanced positions that support some restrictions while still defending access in certain cases, such as rape, incest, or danger to the mother's life. The legal status of abortion varies dramatically around the world. In countries like Canada, Sweden, and Australia, abortion is legal and accessible. In nations like El Salvador and Malta, abortion is banned entirely, even when the mother's life is at risk. In the United States, the legal picture changed drastically after the Dobbs v. Jackson Women's Health Organization decision in 2022, which overturned Roe v. Wade. Now, each U.S. state determines its own abortion laws, resulting in a patchwork of access and bans. Abortion is never just a medical procedure, it's a deeply personal experience. Studies show that the majority of women who have abortions do not regret their decision. However, some may experience complex emotions, especially if they lack support or face stigma. It's also important to recognize the broader social realities. Many women seek abortions because of economic hardship. Others are in abusive relationships or already raising children. Some face health complications or receive a diagnosis of fetal abnormalities. Supportive counseling, non-judgmental care, and access to mental health resources are crucial. Studies consistently show that comprehensive sex education, access to contraceptives, and affordable healthcare significantly reduce unintended pregnancies, and therefore reduce the need for abortion. Yet, in many parts of the world, these resources are limited or politicized. Empowering people with accurate information, safe medical care, and reproductive autonomy is key to improving health outcomes. Abortion is a deeply personal and complex issue, tied to science, ethics, law, and lived experience. There are no easy answers, but open, respectful, and informed conversations can help us understand each other better. Whatever your personal beliefs, the reality is that people will continue to face unplanned pregnancies. How societies respond, with empathy, judgment, support, or restriction, will shape the future for generations to come. Thanks for watching. If this video helped you learn something new, consider liking, sharing, and subscribing. And most importantly, keep the conversation going, with kindness, compassion, and curiosity.